I hope you are doing good. I'm Satya from Anyo, and as part of our weekly Wednesday wellness sessions, today we are having a quick chat with our Ayurvedic expert, Dr. Havisha Raj. Hello, Havisha.
Hello. Yeah, hello everyone.
And one of the most common concerns these days is pre-diabetes. Often a lot of people, they do all the annual checks these days. People are very aware and they want to prevent it before it goes into diabetes, but sometimes also due to genetic reasons or some other reasons, we all are prone to diabetes. So that is
Yes.
why we thought to ask about the diet do's and don'ts with our Ayurvedic expert. And before we start, she's also has a holistic approach, and she doesn't easily recommend any medications. She always tries to sort it with simple home remedies and all, and that is why we
Yeah.
wanted to check with the diet from Havisha today.
Yeah.
Welcome again, Dr. Havisha.
Thank you.
Uh,
Thank you so much.
so I think we can get into the do's first in terms of
Yeah.
diet. If someone has diabetes.
Yes. So the do's of diabetes are, you would have heard many people say, many times doctors say that you should have smaller meals many times during the day. So that with research now, the latest news is you are not supposed to have smaller meals many times in a day. You should, in fact, have larger quantity of meals fewer times in a day. And why they tell this is because every meal, everything you put in your mouth is going to spike insulin in the body. So we don't want to spike insulin many times in the day. So if you have larger meals, it will spike according to the meal that you have eaten. So which will balance the glucose level in the body. And also you, if you have smaller meals, you tend to feel hungry very soon. So if you have larger quantity of meal, it's better for the body's metabolism also, because it allows the insulin to spike only for that period of time. So that is the first thing which I wanted to share, because it's a very common thing that, they say, please have smaller meals many times in a day. But now the research shows that will not work out. So the second point I would like very stress it is, you should always start your meal with fiber. You should have high fiber meal, fiber in the sense like salads or sprouts, something like that. Because when you have, as soon as you start to eat a meal, if you have sugar or high carbohydrate meal, that will also lead to the gut microbiome. It won't be, you won't have the proper gut microbiome. So the fiber what we eat is the food for the gut microbiome. So that will invariably, it will act on the meal and it will form short chain fatty acids, which is very beneficial for the body. So you need to start your food with high fiber diet. You should have a lot of fiber in your food when you eat it first, the first meal what you take.
You
The
mentioned
third,
examples. Sorry, you mentioned salad and what's the other thing?
sprouts.
Sprouts. Okay, right.
Anything that has high fiber in it, like any raw vegetable you can eat, like tomato, carrot, cucumber, lettuce, or cabbage, radish, anything with just a small quantity of fiber first, and then take your meal. That will take care of the gut microbiome.
Does anyone here take salads? To let us know in the chat. Yeah, right. Okay.
Yeah. The third most important point is you need to check vitamin D levels regularly, because
Hmm.
the latest research have showed that vitamin D is directly related to the sugar level in the body.
Right,
And
vitamin D. Yeah, I think
yes,
most of us
yes,
are feeling
vitamin D.
it.
Yes, yes, right. Why you need vitamin D, because it helps to maintain the proper glucose level in the body. This is also one of the research findings now.
Right.
And it is also a natural antioxidant, vitamin D. So you need to, if people say you go stand in the sun, you'll get and all that. But nowadays, what we are seeing is that is not sufficient for the body. So you need to take some kind of supplementation only for vitamin D. But if
Right.
your vitamin D levels are correct, then you'll also see there's a lot of difference in the sugar levels also.
All right. Those were here. That is very recent news. Like it's very new
Yes.
even to me. So let me know in the chat if you already knew this or is this new to you. All right. Okay.
Yeah.
So I think we have gone three. Right. Okay.
Yes.
Is there any more?
So the fourth one is you should have, people say you should not have fat when you have diabetes. I would recommend eat healthy fat during diabetes or any problem. Generally, for general health also, you need to have healthy fats like avocados, ghee, butter, dry fruits. These are all healthy fats. The same way, groundnut and coconut are also healthy fat if you don't roast them. You should only steam cook them and have it. Steamed
Okay.
version of groundnut, or after making a sabji or something, just sprinkling coconut on top, or even for any kind of South Indian dish, or grinding the coconut directly for chutneys and all is fine. You should not roast it with oil. That is where the problem starts. Groundnut also you should not deep fry it or roast it. You can steam cook it and have it. It's extremely beneficial for the body because it's high protein also.
Right.
Yeah. So fat is very important for the body because every cell, the outer covering of every cell is made up of fat and protein. So when people say fat is not good, they only mean fat in the form of oil, because oil is not very healthy. I would say oil, we should take in small quantities, not completely stop it. We can take oils like cold pressed oils, or when we go, like they make fresh oils in the chakki row. Those
Here.
kind of things are extremely beneficial, except especially groundnut oil and sesame oil is very good. Like fresh, they'll make it just in front of your eyes and give. Like there are a lot of places now like that.
Yeah.
They'll cold press it and give it to you in a can.
Yeah. There is a lot of
Yeah.
awareness in recent days. Yeah. Yeah.
Yes, yes. So those kind of oils are still better. But anyways, in our cooking, oil quantity is less only. So it is fine. But I would say healthy fat, definitely ghee and butter must be taken, because ghee, according to Ayurveda, also is very, very beneficial for the digestion, and also it lubricates all the joints.
All right. So healthy
So
fats.
ghee is very important.
Okay.
Yeah. So this is about fat in diabetes, because this is also a very common thing that people say you should not have any fat, you should cut down on all the fats. No, it is not like that. You should cut down on oils, but not on healthy fats like these. That is
Okay.
butter, ghee, avocados, and dry fruits.
All right.
And
So
then yeah,
yeah, please go ahead. Yeah.
yes, the other very important point is people do not want to go for blood tests often, or regularly, at least not even often, regularly at least they should do HbA1c and blood sugar levels, because just by feeling that, I say I'm feeling okay, so I don't have to check, doesn't work out in diabetes. So we
Right.
need to check it with proof. So because at least to know whether we are following all this, whether it is working on the diabetes or not.
That's
So for
true.
that reason we need to know.
Yes, totally. Because I have seen many friends and the family members. They kind of sometimes there is a family function and we totally forget the medicines or routine.
Yes.
And yeah, so
Yeah, that is very important in diabetes. We need to do regular checkups. Just cannot say that I am feeling good, so I don't have diabetes. No, that doesn't work out like that. Yeah.
all
So
right.
these are all some of the do's. I'll go into some of the don'ts now, which are also very important.
Okay.
Yeah. You should not make smoothie and have. No, it's not only for diabetes, it's for anybody. Because when you make smoothie or when you grind something and have, you're losing out all the fiber in it, and fiber is the most important for our gut.
Okay.
So, yeah, and people tend to have more of fruit juices in diabetes, thinking that they are going to have only one glass of juice, so it is nothing compared to eating a fruit. But
Mhm.
fruit juices will spike the sugar level or insulin to a much larger extent than the eating the fruit as it is. because fruit will have fiber in it. So eating the fruit as it is much beneficial than grinding it and making it to a juice or a smoothie and having it, because the fiber is gone.
Okay.
So we need the fiber. So eat it as a fruit only. That is much better. And you can have seasonal fruits. Absolutely no problem if you have it directly as a fruit, not like a juice or a smoothie.
Okay.
And seasonal fruits also, like especially mango, jackfruit, banana, and all these things should be have had in limited quantity only, because these are the fruits which have natural, very high sugar content, fructose level in the fruit itself. So if I say, okay, you can have, and people start having half kg mango every day, doesn't work out. So that doesn't work out. You can have mango instead of like restricting completely. You can have, but very small quantity. You should have limit in everything. That's all.
Fresh. Okay.
Yes, moderate ratio. Yeah. And eating fruit like musambi, orange, and all also, instead of making juice and having as it is much better. In any case, not only in diabetes, in any body condition, that is the best approach.
Okay,
So
great. So, uh, to highlight whatever you said, you're saying whole fruit is better, and also seasonal fruits in moderation is good.
yes, yes. You can
Okay.
have sitafal, you can have sapota, you can have banana, you can have pineapple, mango, all high sugar fruits also. But make sure you have in small quantity. And fruits should always be taken after a meal, never in empty stomach.
Okay.
Because when you're having fruit directly on empty stomach, it has high fructose level, so it spikes the insulin immediately.
Mm.
So when you have a fiber diet, when you have a fiber, then you have your meal and then have a small quantity of fruit like a dessert, like a treat for yourself, that nothing will happen.
Okay. Oh, is
Yeah,
this for only diabetics or for applies for everyone?
everybody. This rule applies for everybody.
Right.
Yeah.
Okay.
Because I have heard many people coming to us as telling that we eat only fruits for breakfast. We don't have anything else. So why is my sugar level still on the higher side? So this is the reason.
Now
Because
we do.
the fruits are natural candies available in nature. So the candies only should be taken as treat, not as a meal.
Right. Okay.
Yes. So because it's because of the fructose level in it.
Okay.
Yes. So another very important don't, not only for diabetes, especially for diabetes, but not only for them, for everybody is don't have any packaged food because it's easy, or don't have deep fried foods.
Okay.
See, the cholesterol level increases. People say, oh, my triglycerides are high, that is high, this is high, is only because of eating very high low fat food. Also, people promote a lot these days, right? In low fat food, what is the problem is they'll say the fat is low in it, but they would have compensated it with high sugar. So
Okay.
when somebody reads the ingredients, we will know what is the carbohydrate percentage, what's the sugar percentage, and what is the fat percentage. What they claim will be correct. They would have put low fat only, but they would have increased in carbohydrate and sugar.
Hmm.
So that is a myth not to be followed. Like you cannot have low fat food in any of the health conditions. You need to have high fat diet, which is healthy fat.
Okay.
Yeah. You need
So
to have
healthy.
high fiber, high fat, high protein diet. Okay.
Hmm.
Carbohydrate is also must as Indians, but the carbohydrate quantity should be limited.
Okay. Got
Not
it.
like totally cut down on carbohydrate. We'd never tell anybody to cut down totally on carbohydrate. It's not possible by Indians. So we'll say reduce the quantity of carbohydrate, increase the quantity of protein and fiber.
All right.
Yeah,
Okay.
and this is not only for diabetes, it's for everybody. This rule is for
Yes.
everybody.
So as
Yes.
you say, reduce the quantity of carbohydrates. I realize like a lot of people, we are so used to having a lot of rice and a little bit of veggies or
To have those
roti.
more and less of rice.
Even
Yeah.
if we go to restaurants, it's the same. They give a tiny bit of side dish, and
Yes.
unless we order it as a separate dish, if
Yes.
I order a roti, for example, I get a very tiny portion of that sabji, whatever it comes
Sabji.
with it. Yeah,
Yeah.
so it has become a very part of our culture.
Yes, it'll take time for anybody to, come out of these things that they've been told for so many years. Oh, you have to be this way, you have to eat this way and all. Now researchers, studies and all have come with various other things like these. Like so many values are interconnected, so many things are connected to diabetes directly. So
Mm.
that is the thing. And never never overboil, over roast, or overcook any of the food items that you make. Okay, steam cooking is one of the best options. So that is like really good. Or pressure cooking is also very good.
Oh, what about
Mm.
using a little oil and stir frying?
Yeah, you instead of oil, you can even use ghee or butter for stir frying.
Mm. Okay.
In fact, for instead of oil, if you use ghee or butter, you will need even more lesser quantity then because it smears so well. It coats the vegetables so well. So
Right.
even small quantity of butter or ghee is enough for stir frying then.
Mm. Okay.
Actually,
So
in
not.
olden days, they used to use ghee or butter only for all cooking types.
Okay.
So the concept of oil and all came much later only because it became easy to do. So people started reducing using ghee and butter. Now we are promoting it more and more because many people have stopped eating ghee, thinking even eating this much small quantity of ghee will give them triglycerides and they'll get high cholesterol. No, which is not true. And one more thing, when I tell you have high fat, when I tell ghee and butter, preferably what we make at home, ghee and butter is the best form than getting ready-made ghee from the shop. Because again, they will put a lot of preservatives because they need that ghee to stay in that same consistency.
Okay,
So
so I think you can add a recipe on how to make homemade butter and
yeah.
ghee. Ghee
We can
also,
make
I
home.
think some people make, some people don't know. So
Yeah,
yeah,
no,
please
I'm
do
telling
add.
even if they cannot make, maybe people don't make curd at home, they cannot make ghee and
Yes.
butter at home. It might be a difficult process because all of them are working, everyone is busy. I would suggest buy butter outside and melt it and make ghee at home instead of buying ghee directly from outside. Even you can buy good quality butter, some source which is really good for butter. Get that butter and melt it in the house and make ghee.
Mm, okay.
That is a very easy process. It will hardly take 10 minutes.
Yeah, just simply
Yeah,
placing it in a
that
pan
will
and
be super
yeah.
satisfying for you also to have it.
Right. Okay. All
Yeah.
right.
So
So
these are fruit juices. Yeah, like how I said before, fruit juices. No, fruit. Yes, directly as a fruit. Yes, fruit juices not so often because this is another common thing which we have found that people say, yeah, I have juice. That is fine for me.
mm,
So it's not fine actually, but they're thinking that it is fine for their body.
right.
Yeah.
Okay. I think that's quite a handful of useful and practical tips. Actually, is there anything more? Sorry.
No, I think I am done. The other important thing is you need to exercise every day.
No compromise.
No compromise, especially you should do yoga instead of going and working out in the gym. Doing yoga is much better.
Okay, great. So, thank you for all that. And those who are here, is there any questions relating to your diabetes diet, or even anything relating to, health? Like she's an Ayurvedic expert, so she can help you with diet and lifestyle. So if you have any questions, do post them in the chat box. Let us know if there is any new information you gained today. And okay, we have a chat. Okay, let's see. Um, what is the sugar level to be maintained as a diabetic?
There's fasting and postprandial. Fasting should be less than 100 for sure, and postprandial should be around 150 like that. And more than this sugar level, we concentrate on something called insulin level, which is fasting insulin and postprandial insulin. That is more important for us for diagnosis also.
Right.
Yeah, because that also nobody does the testing for insulin, but now people have started to include that in the testing. So insulin level, we need to know where the correct level of insulin, what their body is producing, we need to know. So that's why same like how we do testing for sugar, fasting and postprandial, we need to do for insulin also.
All right.
That insulin level will tell us if if the person is insulin resistant or not.
Okay, that is definitely new. Yeah, somebody says it's never heard. So
Yeah.
yeah, I think it's a very recent thing.
Yes, yes, that's what we, because the more and more treatment people are giving, the more and more diabetes is increasing. So why we don't know. So that is why all these researchers have started to see if there is anything else connected to diabetes which we can turn around. We can treat these things so that the diabetes level is maintained.
Right. Okay, there is one more question. Should we stop eating fruits during sugar cut? Uh, Sugar cut. What is it? Uh,
Sugar cut in the sense when they are not having sugar.
okay. Is it like a no sugar diet, something like
When they have a no sugar diet, yes, you cannot have fruits because fruits are the main source of fructose. They can increase insulin and glucose.
All right. Okay. So, how often is that for the insulin test? Maybe
Sorry, I couldn't hear you.
somebody, the person who asked about sugar levels, and you
Yes.
mentioned the insulin test. They have asked
Yes.
how often.
No,
Is it
no,
about?
it doesn't have to be often. We can do once in the 4 months also. Like, because if we know the insulin level, we will start treating the insulin only first, not the sugar.
Hmm,
When we correct the insulin level, the sugar will automatically be regulated. So after 3 months, we can again check the sugar level and the insulin level to see if they are balanced.
right. There's another question. It said that muscle eats the sugar in the body. So, isn't gymming better than yoga to build muscle?
Actually, why I would suggest yoga is because there is no it's a wrong concept that yoga you cannot build muscle. You can build muscle in yoga if you are doing it under the right guidance, because in yoga breathing is the most important thing, and breathing is very important for the metabolism also. So we need to have the correct yoga techniques and everything. Why I would not suggest gym is like I people who are aware of how to do the gym is all fine. Now in the name of excessive exercise, they are doing excessive gym and leading to some other problems. Like we have heard now recently off late itself, so many people collapsing in the gym itself.
Yeah.
So overdoing anything is not good. Even I'm telling overdoing yoga also you are not supposed to do. Everything you have to do it moderate only. Why I'm telling gym is because again to have that muscle building activity and to do the gym, they have so much of high protein powders. Again, the
Yes.
protein powders are not okay. That I need to take another session. That is another long
We'll do
story.
another session on
So
that maybe.
with excessive protein powder that affects the kidneys in some way or the other. So every people are only thinking that okay, I need to go to the gym, so I need to have high protein. So if I have to have high protein, the easiest way is to have protein powder. So if I have protein powder, I can do gym for any long. No, that is not even the connection. That doesn't work out like that at all.
Right. Yeah.
Yeah, because I have hardly seen any protein powder which has no sugar in it.
Hmm?
So many protein powders, the main ingredient will be sugar only. If they
Okay. So, in case people are using, they should either go for a no sugar option carefully, or
Yes, yes, they should go for no sugar option. Or there is a way, like you if you have to do gymming also, you need to do gymming for 3 days a week or 4 days a week, and you have to take 3 days break. Only then your muscle will come back. It will react to what you're doing. Otherwise, you're only gymming every single day. I'm gymming because in the form of exercise, I need to do something. So I'm doing only that, but there is no result. It's just going to create some other problem.
Okay. I think we will organize a separate session on this topic.
Yeah,
So I
yeah,
think
that
there's a lot of
will
insights.
organize a separate. Yes, yes.
All right. So for now, I hope that answered your question. I think Rucha asked it. Okay. So one last question: how fasting affects the sugar levels?
Fasting is controls insulin. Okay, so from being insulin resistant, you will become insulin tolerant. That is the main criteria for us to maintain the sugar levels. If your sugar is low, if you say my sugar is low, my glucose level is low, my glucose level is only, my HbA1c is only 5.2, 5.3, that means your insulin must be high. Because only when your insulin is high, your sugar level will be low. So if your insulin is high, that means you're going into insulin resistant state. So when you're going into insulin resistant state, that time what will happen is all the other parameters will start to show some other issues, like your skin will start having problem, your hair will start having problem, your body, you'll suddenly start feeling weak, you will not have enough energy within you to do much work. All these symptoms will start because they are all leading you to insulin resistant state. You have to maintain the insulin level so that your sugar level is also okay.
Okay.
The main problem now is people check only for HbA1c and the glucose level, which is not giving us the full story. The full story will come only when we know the insulin level also.
Okay. So, so based on what you say, fasting, we need to watch
Fasting,
how it affects insulin levels. I mean,
yes,
for person.
fasting is very crucial, very good for maintaining insulin levels, which invariably will affect your sugar levels.
So insulin tolerance is different, right? Insulin resistance and insulin tolerance.
Insulin resistant is you're producing you're producing high amounts of insulin in the body, but where the sugar level is maintained because of that. But what is happening to the excess insulin then?
Mm.
So when you bring down the insulin level, your sugar level also will be maintained, and you will not be in an insulin resistant state, which will lead to all other problems. Now, when people come to me for hair fall and skin issues, we ask them to check their insulin level only first,
Okay.
because that will show us whether you are having a metabolic disorder or no, more than the sugar level. So if
Okay.
you're in an insulin resistant state, that means you are leading to a metabolic disorder.
Okay.
Yes.
Yeah, that
So
makes
that
sense.
we need to, that is a very sensitive measure. So we need to bring that down. How do you bring that down? Is all this high fat, high fiber, high protein, less carbohydrate, and also having a good fasting window. Say you're closing your dinner by 8 o'clock, 9 o'clock in the night. You have to have your next meal in the morning only by 9 o'clock. At least 12 hours of no eating window should be there
Okay, got it.
for
Okay.
the glucose and insulin to have a proper maintenance in the body. If you keep eating, then the insulin will keep spiking in the body to maintain that sugar level because of the food that you're eating.
Right. This aligns with how you said eating too frequent meals is very bad.
Exactly. Same thing.
Right.
You're eating frequent meal, you're not allowing the insulin to come down. You're only spiking the insulin because it has to maintain the sugar level.
All right. So it sounds like a balance of eating and not eating, leaving space between meals. Yeah. So overall, I think this is one takeaway. I think everyone here will appreciate today, like the fact that we are recently focusing on the insulin levels more than the blood sugar level. So thank you
Yes,
very much
that
for
is
sharing
very
that.
important. It's not only important for diabetes, it's very important for all others also to check insulin level because that will tell us the story, what it is actually.
Okay. So I think okay, there is one more question. Do you have time? I think we can take just this
Yes,
one
yes,
and
sure.
we'll close, guys.
Yes, sure.
Should we stop eating every fruit, or is there any limit on how much we eat?
You should not stop eating anything. That is the main thing. You should not stop eating anything. You can have fruit, you can have dry fruits, everything. Dry fruits also are considered like fiber and high fat. So dry fruit should be eaten before the meal. Like suppose you want to eat some dry fruits in the morning, have it before breakfast, not along with breakfast or after breakfast. Same with fruits. Fruits you should not have in empty stomach. You can have fruit after you eat a meal. Like say I eat a meal, I want to eat a small banana. I can have no problem because already my fiber would have started act. The fiber that I'm eating first would have started acting on my gut microbiome. So if I eat a fruit after the meal, it will not affect the insulin level to spike up or the glucose level to spike up to that extent because my gut is already doing its job.
Right. So
So
I
you
hope.
nobody should stop eating anything. You can have fruits, eat everything in limited quantity and after a meal. Fruit should be eaten after a meal only.
So I think you mentioned the starting the juice. People can eat seasonal fruits,
Yes,
in moderation.
yes.
What you
Like,
mentioned, and
like if you have 4 pieces, 5 pieces of mango, nothing will happen. You can have. But if you want to sit and eat 2 mangoes, it's a problem. That is a problem. You need to know what is the quantity that you can have. I'm not telling this is only for diabetes. I'm telling for everybody who will have very good sugar level cannot sit and have that quantity of fruits or anything like that.
all
And
right.
especially in diabetes. That's all.
Okay. Can we eat amla in the morning? I see
Yes.
that there's a lot more questions coming up. So no problem. So we'll answer this one. But before that, let me tell you quickly, like if you have the Anyo app, in the home page, in the bottom, you can see a menu called Circle. At any point, even after this session, if you have any questions, you can always post it anonymously if you prefer privacy. All these questions you can ask anytime in that group, even in the night, and whenever our experts are available, they'll answer you directly in the post. Uh, and also, Dr. Havisha is available for one-to-one consultations in the Anyo app. In the homepage, Anyo homepage, in the bottom again, you see option called Experts. And if you go there and you can search for the expert, you search for Dr. Havisha Raj, and you can book a session with her at your own convenient time. So you can get more personalized advice from her. And before we leave, I think we'll just take this. I
Yes,
think
sure.
we are getting a lot more questions, guys. So I think it is 4:50, and are we running out of time, Dr. Havisha? Or how about two more questions?
No, no, no problem. You can ask me the question.
All right. So one is about can we eat amla in the morning before
Yes,
breakfast?
yes, you can have.
Okay. The other one is normal 3 meal per day versus 16 hours intermittent fasting, which is better.
I would say 16 hours intermittent fasting because we are all fasting people and we have seen amazing health benefits because of that. It's not only like, I'm not saying because I feel it that way. I have taken a blood test report 3 months before. I've done intermittent fasting and taken a blood test later, and I've seen a huge difference in my values. So, intermittent fasting, I would recommend, definitely, I would recommend intermittent fasting, but there are a lot of do's and don'ts in intermittent fasting also. So if
Okay.
anybody is doing, we need to do it properly.
I think we will do another session for intermittent
Yeah,
fasting.
I will do another session for that for sure because because people don't know what should be done. It's an awareness problem only actually. So
Hmm.
we say just start doing fasting. They start doing fasting, they start becoming weaker, their hair starts to fall, everything because they wouldn't concentrate on the micronutrients. Micronutrients are also very important as much as the nutrients are.
All right.
So we need to balance everything and do fasting in such a way that we feel very healthy and fit at the same time. There is no other issue starting because of that.
Okay. So I think that's a lot of insights, guys. So thank you everyone for posting your questions. It was very interactive, and we appreciate it totally. So if there is any more questions, like I mentioned, please do post in the circles, which is like a social wall, community wall, and also consider a consultation if you have any personalized question. So thank you again, everyone, for joining. And Dr. Havisha, thank you so much for answering
Thank
all
you
those
so much.
questions.
Yeah, thank you.